Vitamins and minerals are essential nutrients that support a wide range of bodily functions. It helps with our immune system, energy production, bone health, and wound healing. And those are broken up into two different categories: fat soluble vitamins and water soluble. So, fat soluble vitamins are organic compounds that are absorbed into the body along with fats or oils in our diet, and they store these in our liver or fatty tissue. Now, those key vitamins are vitamin A. This includes retinol, carotenoids. We need this for vision, our immune function, and growth and development. Vitamin D is essential for bone health, helps us also to absorb the calcium we take in, helps with immune function, cellular growth, and also our neuromuscular function. Vitamin E is involved in cellular signaling and protects our cells from oxidative damage by free radicals through its antioxidant properties. Vitamin K, that's very essential for blood clotting and for metabolism of the bone. Now, because these are slowly metabolized, there is a risk of toxicity if excessive doses are taken. Water-soluble vitamins are next. Water-soluble vitamins are not stored in the body to any significant extent. So these are vitamins that we have to have regularly in our diet for proper balance. So a couple of the key ones we have here, the B complex vitamins, a whole slew of those. They participate in energy production, red blood cell production, metabolism, and immune function. They also act as some coenzymes in some of our body functions. Vitamin C, these are antioxidants, and they help with several functions as well, with our immune response, collagen production, iron absorption, and skin health. We have major minerals, or what we call macro minerals. These are essential nutrients that our body needs in relatively large amounts at the right balance so they'll function properly. Now, the major major minerals that we're going to look at are calcium, phosphorus, magnesium, sodium, potassium, and chloride. Calcium helps with our strong bones, teeth, muscle contraction, blood clotting, and nerve transmission. So where do we get calcium? Number one spot is our dairy products, but also from those green leafy vegetables. Also, a lot of foods that have been processed are fortified. A lot of our cereals are fortified with calcium. Phosphorus is next, and phosphorus is important for bone and teeth formation, energy production, and cellular structure and function. So phosphorus is in a ton of different foods. The dietary sources most common would be our meats, fish, poultry, eggs, dairy products, nuts, legumes. Magnesium is the next one we'll talk about. This helps with muscle and nerve function. So remember that magnesium is going to have to do with those nerves and the tightening and releasing of our muscles. It also helps with blood sugar levels, maintaining those, bone health, and it helps to regulate our blood pressure as well. Dietary sources are the green leafy vegetables, seeds, nuts, and whole grains. The next one is sodium. Sodium helps with our fluid balance. It helps send out those nerve impulses and muscle contraction. So some of the dietary sources that we get this from is table salt. Table salt, processed foods, and packaged foods. A lot of sodium in our diet. Potassium, its function is cell function, nerve transmission, helps with muscle contraction, regulation of fluid balance, and it's going to counteract the effects of sodium on the blood pressure. So we talked about before about how sodium and potassium have an inverse relationship. So if one's high, you know the other one's going to be low. Now, some good sources of potassium are going to be a lot of our fruits like apricots, prunes, bananas, vegetables, legumes, and dairy products. Also watch those salt substitutes like Mrs. Dash and things like that. They tend to have a lot of sodium in them as well. Chloride, it's important for fluid balance, formation of our stomach acid, Remember hydrochloric acid? That's where it's coming from. Nerve and muscle function support. And we get this from processed foods, some vegetables, like lettuce and then like tomatoes. Trace minerals, or what we call micro minerals, are needed in small amounts in order for our body to function correctly. Now, the key trace minerals that we look at are iron, zinc, copper, selenium, iodine, manganese, fluoride, and chromium. So let's talk about a few of these. Iron. It's important to our body to help with oxygen transmission, energy production, and our immune function. We get iron from red meats, poultry, beans, and again, those fortified cereals. You might see it fortified with iron. You might see orange juice that says fortified with iron or fortified with calcium. Zinc is the next one. We have to have that zinc for wound healing and growth and development. Dietary sources for zinc are going to be things like meat, shellfish, legumes, seeds, and nuts. Now we do need some copper also in our diet. The copper is going to help with the iron metabolism. Think about if you've ever tasted blood. Maybe you cut your mouth or something and it kind of has that metally taste. That's the copper you're tasting. Helps with the formation of red blood cells. Helps to maintain our nerves, blood vessels, and our immune system. And copper is also an antioxidant. Dietary sources are going to be things like shellfish, nuts, seeds, whole grain products. Iodine is another one I want to talk about. The function of the iodine is the thyroid hormone production. That's its primary role. It also plays a role in early skeletal and nervous system development. Some dietary sources, iodized salt, seaweed, seafood, dairy products. Again, we shouldn't need any extra to our diet. Fluoride, then the reason we need fluoride is for our dental health. It's supposed to help prevent tooth decay. Also, formation and growth of new bones throughout our skeletal system. So some of our dietary sources are going to be things like fluoridated water, black tea, coffee, and shrimp. So the need for vitamin and minerals starts as we're an embryo, and it's constant throughout all of our stages of growth and development. Remember, vitamin A is for vision health. It helps that embryo grow through the involvement of organ formation. Vitamin D, we need that for skeletal system growth. Vitamin C is for growth and repair of our tissues, helps us to form collagen. It helps to build our skin, cartilage, tendons, ligaments, and blood vessels. B vitamins are vital in many places of our development. In early development, the vitamins that are specifically important are thiamine, which is B1, biotin, which is B7, and folate, which is B9. So this is why we have those moms, if they're at childbearing age, we want them to take extra folate in case they were to get pregnant. It can help to prevent some neural tube defects. As we're growing, the minerals that we need, calcium is very important because we're going through rapid growth phases. Iron we need for our hemoglobin production, and zinc is involved in our cellular metabolism, and it's very important for growing during pregnancy, childhood, and adolescence. And again, that iodine is for thyroid hormones. Some things that help with development are vitamins D, B6, B9, which again is that folate, and B12. Some minerals involved with human development are going to be iron, iodine, and zinc. Iron is essential for cognitive development and overall growth in children. Iodine impacts their cognitive development, and severe deficiencies have been shown to cause decrease in intelligence, especially in children. All right, so let's talk about some specific vitamins and their functions and what happens if we have a deficiency with those. Vitamin C, ascorbic acid. This is important for various biological functions, so functioning as an antioxidant, playing an essential role in the biosynthesis of collagen. Rich sources are going to include those citrus fruits, and also strawberries, kiwi, guava. Some other vegetables like bell peppers, broccolis, Brussels sprouts, spinach, those are rich in vitamin C as well. If we have a deficiency, say we're not taking in enough, we can start to have some malabsorption syndromes. The resulting condition can be what we call scurvy. We realized how important vitamin C was when we were having people come over from other countries on ships and they didn't have fresh fruits and vegetables, and they begin to develop scurvy from the lack of vitamin C. Vitamin D is very important for mineral balance and bone metabolism. One place we get vitamin D is just by being out in the sun. Another place that we get it is from our food. So the fatty fish, fish liver oils, fortified foods, egg yolks, those are all vitamin D rich foods. There's also over-the-counter supplements if you need additional supplements. So think about maybe somebody in wintertime when it gets dark early, people are inside, they're not outside a lot because it's too cold and we don't see the sun shining, so people can kind of get low in vitamin D and it kind of depresses them a little bit. So during that time, they might start taking vitamin D supplements. Now, deficiency can come from, again, as I mentioned, the limited sun exposure, if they have a malabsorption syndrome, kidney and liver disease, obesity, or just a diet low in vitamin D. So if our bones are not getting the vitamin D that they need, it's going to cause our bones to weaken. So we'll have osteopenia, osteoporosis, and they can have an increased risk for fractures, and as I mentioned just a minute ago, an increased risk for depression. Vitamin E, this is an antioxidant, and it helps to neutralize the free radicals. It's involved in human immune function, DNA repair, and some other metabolic processes. Some good sources of vitamin E are going to be in those plant-based oil and nuts. So the good sources would be things like sunflower oil, safflower oil, wheat germ oil, almonds, peanuts, hazelnuts, those green leafy vegetables, and again, those fortified cereals. So you can have a deficiency based on maybe a genetic disorder, malabsorption syndrome. We may see an infant that might be premature, have low birth weight, and they might show some signs of vitamin E deficiency. If we have a deficiency, it can cause our nervous system to be impaired. It can cause muscle weakness, vision problems, and again, because it helps to support our immune system then would be impaired. The next vitamin is vitamin B12. This is basically obtained from animal-based foods. It's very important for red blood cell formation, central nervous system function, and DNA synthesis. Some good places we can get this are organ meats, fish, poultry, eggs, dairy products. If you are a vegan or a vegetarian, you might look into some fortified foods for that. You can also get supplements. You may see someone who, an older adult, maybe they start to lose that intrinsic factor, which helps to create that vitamin B12. You might see them get monthly injections of vitamin B12. So some of the reasons that they might be deficient, again, is if they're not eating well, in poor dietary intake, pernicious anemia, if they have GI disorders like Crohn's disease, if they've had a surgery like a gastric bypass and it removes part of the stomach or part of their intestines. Some medications like metformin can hinder the absorption in the gastrointestinal tract. If that happens, if you're deficient, you can get megaloblastic anemia and you'll have some neurological function. It's very important that we address vitamin B12 deficiency promptly, because if we don't address it and take care of it, it can cause irreversible damage. The next one is folic acid. Folic acid plays a critical role in our DNA synthesis and repair, helps with red blood cell formation and cell division. It is very important, particularly during periods of rapid growth. So again, think about you have an embryo that is starting to grow, how quickly it is dividing and growing and multiplying, and then you have, your little babies, and they're growing very fast. So it's very important for them. Some rich sources are going to be those green leafy vegetables, legumes, citrus fruits are also high in folic acid. And you can get it in, again, some fortified foods as well. So if you have a deficiency, it could be because you are not eating well, your diet is poor, you might have some type of condition that affects absorption. We also have an increased need of folic acid during periods of rapid growth. Maybe you're taking a medication that interferes with folate metabolism, so something like methotrexate, and it can cause fatigue and weakness, can cause megaloblastic anemia, and again, as I've mentioned a couple of times, neural tube birth defects. Iron is the last one we're going to look at. Iron is crucial to enzymatic reactions, energy metabolism, and functioning of the immune system. Now, there's two types of dietary iron. There's hemi-iron, which we find that in animal products, and non-hemi-iron, which is going to be in the plant-based foods. Hemi-iron, and remember hemi meaning the red, okay? Iron is present in red meat, poultry, and fish. Non-hemi-iron, we can find that in things like lentils, beans, tofu, spinach, fortified cereals. And we might have a deficiency because of our diet. We might need increased iron requirements. Maybe we've lost a lot of blood, or maybe for some reason we do not absorb iron. This can cause fatigue, weakness, pale skin. You'll look, even if you pull down their eyelids, you'll see in their conjunctiva, it's very pale. They can get short of breath, dizzy, and they get cold hands and feet, and they can get iron deficiency anemia. And this shortness of breath, let me tell you about this because it's kind of important here. A few months ago, I went and gave blood, and I really didn't drink a lot of fluids that day like I was supposed to. And the next day, I got up and I could hardly walk from one end of my house to the other end of my house without getting short of breath. And I was like, what is going on with me? So I started drinking a bunch of water and things, different fluids that could replace some of the fluids I lost, and it got better. So remember that iron deficiency can cause you to be short of breath. Again, think about this. That iron is riding on those red blood cells, and it's going off to take oxygen to our bodies. Okay, and if we don't have that iron, we're not going to be able to get that oxygen where it needs to go. And we do have different nutrient requirements throughout our growth and development. So think about the infant stage. We're talking about from 1 month to 1 year. Infants experience, again, that rapid growth and development, so they need a lot of nutrients relative to their body weight. Some of the key ones that we look for with them are iron for cognitive development, calcium for those bones to grow, and omega-3s for brain and eye development. They also need some iron-rich foods and a variety of fruits, vegetables, and grains, starting at about the age of 6 months to maintain their increased energy. At the toddler age, and this is about 1 to 3 years of age, they need balanced diets that include fruits, vegetables, whole grains, poultry, and dairy. Iron, calcium, vitamins A and C are important during this phase for growth and development. And what we would like for them is nutrient-dense foods and encourage them to have balanced eating habits. They're so busy, they don't like to sit down and eat at this age. So we want to make sure whatever nutrition we get in them is full of nutrients for them. The preschooler, which is 3 to 6 years, calcium and vitamin D are essential for bone health. Iron is also going to support their energy levels and cognitive development. This is a good time for us to really establish some good healthy eating patterns during this age. The school-age child, 6 to 12 years, their nutritional needs increase due to the growth spurts they're having. They're also more physical. They're in school. We want to make sure they get adequate protein for muscle development. We also want to make sure they've got plenty of calcium, vitamin D for bone growth. We're going to give them a balanced diet that includes lean proteins, dairy, fruits, vegetables, and whole grains. Adolescents, and I'm talking about between 12 to 19 years of age, they have a lot of growth and hormonal changes during this time, so that's going to increase their nutritional requirements. Calcium and vitamin D are important for peak bone mass. The iron needs to increase, especially for females that are menstruating. And protein is going to support that muscle growth and overall development. So as a nurse, our job is to provide them guidance with making dietary choices that are going to give them a healthy, balanced diet. And think about this age group, we're talking about junior high, middle school, high school, they're hanging out with their friends. What is their nutritional intake? They're going to Sonic, they're going to McDonald's, they're going to all these different places that does not have good nutritional benefits for their body. And then the older adult, we need to make sure they're getting plenty of vitamins and minerals to reduce the risk of chronic disease. So think about their safety. If they're eating plenty of protein, they're going to continue to get that muscle mass and strength. As long as they've got muscle mass and strength, it's going to reduce their risk of falls and injuries. Very important that they stay hydrated. If they're not hydrated, they can get confused, they can get urinary tract infection, they can get kidney stones. And we also want to make sure they're getting plenty of vitamin B12. Vitamin B12 can help with some cognitive decline and neuropathy. And they're also having some hormonal changes. Calcium and vitamin D are more important to those postmenopausal women. Omega-3 fatty acids help promote cardiovascular health and reduce the risk of breast and prostate cancers. And when we look at men and women, they have different nutrient requirements, different vitamin requirements due to their physiological and hormone differences. So think about iron. Females that are of reproductive age, they need at least 18 milligrams per day to compensate for any menstrual blood loss. Now, when they become postmenopausal, their requirement drops to the same as a male. Calcium, we know postmenopausal women, they need 200 milligrams more per day due to the increased risk of the osteoporosis that's caused by the decline in their estrogen levels. Folate, vitamin B9, females, again, this is probably the fourth time I've said it, childbearing age up to 200 micrograms more per day. Vitamin D, about the equal amounts in both male and female. Vitamin A, men need a little bit more. They need about 200 micrograms more vitamin A than females do. Vitamin C, the adult males need a little bit higher, about 15 milligrams per day than the female does. Vitamin B12, older adults, again, reduced absorption efficiency can cause them to need that vitamin B12 supplement. Magnesium, males need a little bit more because of their body size and muscle mass, so we say an additional 90 to 100 milligrams per day. Zinc, adult males, again, need about 3 milligrams per day due to body size and muscle mass. Iodine, pregnant people need 70 micrograms per day to help support their fetal development. Now, I'm not going to ask you these questions on the exam. I just want you to know what the difference is nutritionally for the male and female. We're next going to look at some different diseases and how that's going to affect their nutrition. So when we're talking about chronic disease, let's talk about diabetes first. That can affect their carbohydrate metabolism, so they need to monitor those blood sugar levels and make sure they have a balanced intake of carbohydrates, proteins, and fats. Those with cardiovascular disease might need a diet low in saturated fats and cholesterol, but rich in omega-3 fatty acids, rich in fiber and antioxidants like vitamin C. Gastrointestinal disorders, I'm talking about disorders that impair the nutrient absorption. They might have to be on a special diet, or they might have to have special supplementation to compensate for that malabsorption to maintain an adequate nutritional status. Bariatric surgery, we know post-bariatric surgery, they have just a small pouch, so they're at risk for a lot of deficiencies because they're not getting those in their diet anymore. Vitamin B12, vitamin D, A, E, K, iron, calcium, protein. So they will probably need to be on a lifelong adjustment because of the small stomach, the decreased absorption, and that will help to prevent malnutrition for them. Cancer, they're going to get tailored nutritional support. Usually we'll give them high calorie, high protein diets and supplements during treatment. It's essential to support their recovery as well. And renal disease, this is a hard one. Those with chronic renal disease, they have to manage their intake of protein, sodium, potassium, phosphorus, because we don't want to further damage our kidneys. We also have to maintain our electrolyte imbalance. So they may have a fluid restriction, and that's very hard if you think about limiting your fluids to maybe say 1 liter a day. That's a hard thing to do.